Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. Which one of the following skin disorders is least associated with tuberculosis? A. Scrofuloderma, B. Erythema Nodosum, C. Lupus Vulgaris, D. Verrucosa Cutis, E. Lupus pernio. Okay, this question is asking about the presentations of the tuberculosis on the skin. We can see Scrofuloderma on skin tuberculosis. We can see Erythema Nodosum on tuberculosis. Okay, we can see Lupus vulgaris on the skin of patients infected with tuberculosis. We can see Verrucosa Cutis, but Lupus pernio, we cannot see it under tuberculosis. The choice is E, Lupus pernio. Explanation. Okay, Lupus pernio is sometimes seen in sarcoidosis, but is not associated with tuberculosis. Skin disorders associated with tuberculosis. Okay. Possible skin disorders in tuberculosis are Lupus vulgaris, accounts for 50% of cases. As we can see here, this one is Lupus vulgaris in patient infected with tuberculosis. Okay, Erythema Nodosum, we can see it in the patients involved with tuberculosis. Scarring alopecia, we can see it in tuberculosis. Scrofuloderma, which is breakdown of skin overlying a tuberculous focus. Verrucosa cutis, we can see in tuberculosis, and gumma. All of these are presentations of skin tuberculosis. Here we can see Lupus vulgaris in a patient infected with tuberculosis. In 50% of occasions, we can see this in the face, in the nasolabial fold of the patient. Erythema Nodosum is another skin presentations of the tuberculosis. We can see Erythema Nodosum in patients with diabetes mellitus, in pregnant patients, in patients which using combined oral contraceptive pills. But we can see it in their tuberculosis. Also, Erythema Nodosum is the inflammation of the subcutaneous fat. Okay, scarring alopecia is another presentation of the tuberculosis on the skin. Scrofuloderma, here we can see Scrofuloderma in the neck of a patient involved with tuberculosis. Tuberculous gumma is another skin presentation of tuberculosis, and Verrucosa cutis, as we can see here, these lesions are called Verrucosa cutis and is another presentation of the cutaneous tuberculosis. Lupus vulgaris is the most common form of cutaneous tuberculosis seen in the Indian subcontinent. It's important. The doctors which are working in the India, when the patients present with Lupus vulgaris with lesions like this in the cheek, in the nasolabial fold around the mouth, then they must consider tuberculosis also. Okay. As we said, Lupus vulgaris is the most common form of tuberculosis, or cutaneous tuberculosis seen in the Indian subcontinent. It generally occurs on the face and is common around the nose and mouth. The initial lesion is an erythematous flat plaque that gradually becomes elevated and may ulcerate later. As we can see here, it's erythematous flat plaque, and gradually, if the tuberculosis is not treated, it may become ulcerate and it may extend to the nose, nasolabial fold, around the mouth, and etc. Okay, here was a short explanation of the presentations of the skin tuberculosis. Thank you for your attention.